Hi, it's Dr. Robert Brueck. I want to talk to you a little bit about breast lift. Very, very common operation. And I see a lot of women that come into my office because of breast surgery. They want to have their breasts enhanced, they want to make larger, and so it's a very, very common, very popular operation. But there's always a stigma of when do I need to consider a breast lift versus a simple augmentation or combination thereof. And I think it's important for you to understand a lot depends on the position of the nipple relative to the inframammary fold. Now, the inframammary fold is where the breast hits the chest wall. Now, if your nipple is above that fold, you do not need a breast lift. If the nipple falls below that by several centimeters, then you have to have a breast lift. Now, assuming you're one of those individuals that needs a breast lift, the next question to be answered is, do I have enough breast tissue where a lift will give me the shape and size of breast tissue that I want? When you do a breast lift, it's important to understand you're removing excess skin. You're not taking away breast tissue, only skin. That is called a breast lift or mastopexy. When you remove skin and breast tissue, now you're talking about a breast reduction. So a breast lift is only the removal of skin. So I always tell my patient, think for a second, why does my breast hang lower than I'd like? Because the amount of skin that you have relative to the breast tissue is greater, hence your breast sags. And this is common, I would say 90–95% of the time after women are pregnant, maybe nursed 1, 2, 3 children or more. Most women will have two situations. One, they lose breast volume. Number two, their breast sag. So it's a very, very, very common situation. Now, many women are fortunate in that they have what we call pseudotosis, pseudo-sagging. Now, what do I mean by pseudotosis? In other words, if you took a balloon and you blew it up, and then you let some air out of the balloon, it's like the balloon or the breast looks tired, but the nipple still remains above the inframammary fold. So in that case, we call it pseudotosis. It looks like the breast is sagging, it looks like it's hanging, but it's really tired. It's like somebody let air out of the balloon. So in that situation, many times just a simple, straightforward augmentation is all a patient needs. Sometimes we'll do an augmentation with some autologous fat grafting to enhance the superior pole fullness and along the sternal area where the cleavage is. So that's called pseudotosis, and the way we correct that is primarily with a breast augmentation. Great operation, but sometimes a woman will need a breast lift where we have to raise the nipple several centimeters. Now, sometimes we'll raise the nipple several centimeters and then we will add an implant to that. Again, there are limits to the size that we can do. That's why it's important to get a consultation, see a board-certified plastic surgeon to decide what size is best for you and what can be done. Now, many times women come in and they're smokers. In that situation, I generally will always try to go ahead and do it in 2 stages, especially if a woman wants to be full. So you do the breast lift, they come back in 6 weeks, 8 weeks, 10 weeks, 12 weeks, whatever, and you do the formal augmentation. Now, sometimes women will come in, they need a lift, not a significant lift, but they do need a lift, and they don't want an implant. So then what do? We do autologous fat grafting. In other words, we'll suction the abdomen, the flanks, the inner thighs, whatever, and we'll take that fat and use that to augment the size of the breast. So there are a lot of possibilities. But again, it's important to understand with a breast lift, it all has to do with where is the nipple in relationship to the inframammary fold. If that nipple is significantly below the fold, and you know, it's kind of cute, women will come in there and say, I can hold up a pencil underneath my breast and it won't fall. It's a pretty good indication that you need a breast lift. So a mastopexy is a popular operation. Again, to review, a mastopexy is only the removal of skin. Skin plus breast tissue is a breast reduction. So again, it's a common operation, especially after pregnancies, and one that we frequently will combine with autologous fat grafting or an implant.